seats. Thank you very much. Your Excellencies, distinguished guests, ladies and gentlemen. The day is the 9th of September, 2025 in the beautiful city of Abuja. In a place where the ambience is quite comfortable, powered by electricity, which is essentially what we are going to discuss here today. Our dear country is literally the largest black nation on God's earth, and to fix power is a critical deliverable that this government has prioritized, as evidenced by the caliber of the people that have come to this event today. Ladies and gentlemen, it bears me witness, and you will bear the witness, that today will mark the change in the trajectory of power in the Nigerian economy. And I mentioned earlier that how do you eat an elephant? You eat an elephant one bite at a time. So as we are fixing power, which is like the elephant in the room, we're fixing industrial power, fixing power for health, and that is why we are here today. The leadership of the country is in the room, and we will be having very critical conversations charting the way forward. Ladies and gentlemen, permit me to welcome very warmly to this event the Secretary to the Government of the Federation, His Excellency Senator George Akume. Please give him a big round of applause. Thank you for coming, sir. That means whatever documentation you need to get power fixed in Nigeria is already done. Also, the Honorable Coordinating Minister for Health and Social Welfare, Professor Mohammed Ali Pate. My boss has just given me some additional information. Protocol demands that I notify you that the SGF is not just here in his capacity. He is representing His Excellency, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu. So as you are seeing the SGF, you are seeing the President. Please give him a big round of applause. I had welcomed the Honorable Coordinating Minister of Health and Social Welfare. You have done so much. I wonder how you sleep. You are always doing this. Cancer. You are doing so much. Professor Mohammed Ali Pate. Please give him a big round of applause. You cannot talk about power without the Ministry of Power. And it is a testament to the gravity and the gravitas in the room, where not only do you have the President here represented, the SGF is here, the Ministry of Health is here, and the Ministry of Power is here, led by the Honorable Minister of the Ministry of Power, Chief Adebayo Adelabu. Please give him a big round of applause. The Honorable Minister of State of Health and Social Welfare has been a driving force of this particular event. I remember in 1999 there was something that said Yo Shinai Yo Kangai. It's Korean, I don't know what it means. But it means good thinking, good product. Maybe I didn't pronounce it well. The level of thinking that has gone into this work, into this summit, reassures me as a Nigerian that is living in Bansi that this is not just another talk shop. And this has been driven by the Honorable Minister of State for Health and Social Welfare in the person of Dr. Isiaq Kunle Salako. Please give him a big round of applause. I want to recognize the members of the National Assembly here present. And permit me, if I do not get your name correctly, but the Chairman House Committee on Health, Senator Ipalibo, is she here? Please give her a round of applause. As well as the Chairman, Senate Committee on Power, Distinguished Senator Eyinaya Baribe. The House Committee Chair on Health, Dr. Patrick Umor, as well as the House Committee Chair on Power, Honorable Victor Onyemachi Nwokolo. Please give them a big round of applause. The Permanent Secretary of the Ministry of Health is here present, and she's none other than Madam Daju Kacholom, member of the National Institute, as well as the Permanent Secretary of the Federal Ministry of Power in the person of Mahmouda Maman. Please give them a big round of applause. So as you can see, it's a tag team. If you watch wrestling, a tag team will always defeat a single individual any day. So we have a tag team of Ministry of Health and Ministry of Power. And I'm not sure electricity that is just standing all alone can face this fantastic tag team exemplified by the people in the room. Please, let's give this team a big round of applause. Okay. The head of service of civil service, the head of the civil service of the Federation is also here represented, and I would like to call the name of Mrs. Didi Esther Walson Jack, ONMNI, and the representative. Oh, okay. I thought the head of service was a woman, so I was wondering what you were doing here. That's all right. Thank you very much. We also have we are behind time, so we may not be able to go line by line, but permit me to just recognize some of the people in the room. Allow me recognize the presence of the chairman of the Nigerian Health Commissioners Forum and the Honorable Commissioner of Ekiti State is representing 37 honorable commissioners. Please stand up for recognition and wave at us. And let me use the opportunity, every honorable commissioner in the room, can you just stand up and be recognized? Thank you very much. The entire Nigeria is here. Please give them a big round of applause. We have a lot. That is why if the people in this room cannot fix power in Nigeria, then let's just go home. Because everybody who is anybody is here. Ladies and gentlemen, we have departments, ministries, and the agencies of government here represented. And allow me, if I miss out your name, I will come back and recognize you properly. We have please allow me to start from my constituency, health. National Primary Care Development Agency, the executive secretary is here. Please stand up for recognition. Because every power must end in the primary health center. Once you fix primary health center, we are sorted. Is that not true? All right. My own constituency, the DG of the National Agency for the Control of AIDS, Dr. Temitope Lori, please stand up for recognition. The DG of the Rural Electrification Agency, Mr. Abba Aliyu, if you're in the room. We are calling you out specifically because we want light in our rural areas. Energy Commission of Nigeria, the DG CEO, Dr. Mustafa Abdullahi. Please clap for him. The DG Infrastructure Concession Regulatory Commission, if you're in the room, please wave at us. Okay. We have our development partners and the agencies here present. I'll just mention your agency. We'll come back to you in the course. We have World Bank represented. We have WHO. We have UNICEF and UNDP if you're in the room. Now, permit me, I'm just an ordinary citizen of this country, and I'm not worthy to even welcome you. So permit me to invite to the stage for a welcome address. Pardon me. want to give me a piece of paper, so there's no need to hide. So to welcome us from the Ministry of Health, remember I said tag team. Anytime I say tag team, just be remembering Okogan and Ultimate Warrior. They will beat anybody. The tag team to welcome us, first of all, will be the Permanent Secretary, Federal Ministry of Health and Social Welfare, Ms. Daju Kacholom, member of the National Institute of the Federal Republic of Nigeria. Please give her a big round of applause. MNI, thank you very much.
Thank you very much. His Excellency, the President of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, ably represented by His Excellency, the Secretary to the Government of the Federation, Senator George Akume, my own minister, the Coordinating Minister for Health and Social Welfare, Professor Muhammad Ali Pate, OON, the Minister of Power, Chief Adebayo Adelabu, the convener and the reason why we are all here, my Minister of State for Health, Dr. Isiaq Adekunle Salako, the head of the Civil Service of the Federation, Dame Esther Didi Wilson-Jack, OON MNI, ably represented by my brother, Dr. Kalba, PAMSEC Common Services Office, Office of the Head of the Civil Service of the Federation, my own dear brother, Malam Mahmoud Amamang, who was PAMSEC Health long before me. I took over from him. You're welcome. All directors of the Federal Ministry of Health, Power, the heads of agencies of health and power, the WR, acting WR, WHO, honorable commissioners, permanent secretaries, heads of agencies, CMDs, MDs, all our friends, development partners, and our ever-enduring friends, the media. Good morning, and you're welcome. It is with profound honor and a deep sense of duty that I welcome you all to this landmark gathering, the National Stakeholders Dialogue on Power in the Health Sector. We are here today not merely to deliberate on challenges, but to forge solutions. The theme, Powering Health through Public-Private Synergy, energizing Nigeria's health sector for the future, captures the essence of our mission to ensure that every Nigerian, regardless of geography or circumstance, has access to affordable and quality health care, supported by reliable and sustainable power. We know too well the reality. When there is no electricity, maternal care is endangered. Life-saving surgeries are delayed. Vaccines lose potency, and digital health systems are disrupted. Power in health is not an abstract infrastructure issue. It is a matter of life, of dignity, and of hope. This dialogue, convened by the Federal Ministry of Health and Social Welfare in collaboration with the Federal Ministry of Power and our esteemed development partners, is a testament to government's commitment under the renewed hope agenda of Mr. President to strengthen the foundations of our health system and build resilience for the future. Distinguished ladies and gentlemen, the high point of this dialogue will be the signing of a historic multi-stakeholder compact, a commitment that unites government, development partners, the private sector, civil society, and innovators in one shared vision to ensure that no health facility in Nigeria is left in the dark. I'm sure you're all wondering why the honorable commissioners are here. That's why they are here. It's a national dialogue. This compact is not just a document. It is a pact of trust, a declaration of intent, and a blueprint for action. I am delighted to welcome such a broad coalition of partners to this hall, from the Energy Commission of Nigeria to the Rural Electrification Agency, from WHO to the World Bank, from clean energy innovators to frontline health champions. Your presence here today sends a clear message. Collaboration is not optional. It is indispensable. Over the next 2 days, we will chart pathways to unlock innovative financing, scale climate-smart energy solutions, strengthen governance and accountability, and ensure that rural and underserved communities are not left behind. By the close of this dialogue, we expect to leave with a compact, with financing commitments, with scalable models, and with a clear roadmap that integrates health and energy for the future of our nation. Permit me at this juncture to specially appreciate the chairman of the Implementation Committee, the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekunle Salako, the Vice Chairman of the committee, Dr. Babatunde Ipaye, and all members of the committee for their tireless commitment in making this dialogue possible. Distinguished ladies and gentlemen, approach this dialogue not as a routine engagement, but as a turning point in our journey towards resilient health systems. Let us be bold in our ideas, candid in our reflections, and united in our resolve to act. Once again, Your Excellencies, distinguished ladies and gentlemen, I warmly welcome you to this transformative gathering. May our deliberations inspire action. May our partnerships endure. And may the compact we sign today stand as a lasting legacy of our collective will to power health for every Nigerian. Thank you for your kind attention.
Please, another round of applause for her. Thank you so very much. Without much ado, we'll go straight to the welcome address to the other arm of the tag team, in the person of the Permanent Secretary, Federal Ministry of Power, Mahmoud Amaman. Please, a big round of applause for him.
His Excellency, the President of the Commander-in-Chief of the Federal Republic of Nigeria, ably represented by the Secretary to the Government of the Federation, Your Excellency Senator George Ekweme, the Honorable Minister of Health and the Coordinating Minister, the Honorable Minister and Coordinating Minister of Health and Social Welfare, my Honorable Minister Chief Adebayo Adelabu, the Honorable Minister of State for Health, the Head of the Civil Service of the Federation, ably represented by my brother Dr. Kalba, my dear sister, the Permanent Secretary, Federal Ministry of Health, Dr. Datu Kachalam, MNI. Distinguished participants, honorable commissioners, let me align myself with the already established protocol. A very good morning to you. It is indeed my great honor and profound sense of responsibility that I warmly welcome you all to this historic first national dialogue, stakeholders dialogue on power. This landmark event convened under the auspices of the Federal Ministry of Health and Social Welfare highlight the urgent need for a unified and enduring strategy to tackle the persistent power supply issues affecting the healthcare facilities nationwide. The link between electricity access and health outcome is unmistakable. A stable power is vital for operating life-saving medical equipment, maintaining cold chains for vaccines, medication, enabling digital health technologies, and ensuring fundamental services like lighting, clean water, and health facilities. On the other hand, unreliable electricity severely undermines healthcare delivery, interrupting, engendering patient safety, driving up operational costs, and placing immense pressure on medical staff. The Federal Ministry of Power recognizes the urgency of this issue. It is committed to partnering with the Federal Ministry of Health and Social Welfare and other stakeholders to deliver effective and sustainable solutions for the health sector. As a nation, our drive towards universal health coverage and sustainable development goals will be unattainable unless we decisively close the energy gaps in the health sector. Through innovative strategies, investment, the ministry aims to ensure a nationwide, uninterrupted, clean and affordable power supply to health facilities. The Federal Ministry of Power, under the able leadership of the Honorable Minister, has remained steadfast in pursuing policies and programs that guarantee sustainable power supply to critical social sectors, including the health. Allow me to highlight a few. Under the Nigerian Energy Transition Plan, this ambitious roadmap would envision universal energy access by 2030 and carbon neutrality by 2060, places strong emphasis on powering social services such as health centers through renewable energy. Under the Solar Niger program, we already envisage the centralized solar system have been deployed to schools and health facilities across underserved communities. This initiative demonstrates that renewable energy can be rapidly scaled up to transform service delivery in healthcare. The Great Expansion and Rural Electrification Project of the REA through the Transmission Company of Nigeria and the Rural Electrification Agency, efforts are ongoing to strengthen transmission infrastructure and expand upgrade renewable energy solutions that directly benefits rural health facilities. Under the energy efficiency in public buildings, which is being anchored in partnership with international organizations, we are promoting high efficiency technologies such as inverter, air conditioners, smart energy management system, which will reduce operational costs in health facilities. Others include the EHAT project, the RE Solar Hybrid Development, the Nigerian Solar for Health Program, tertiary education hospital solarization program are also geared towards increasing renewable energy access in health facilities. The National Stockholders Dialogue brings together an exceptional assembly of experts from the health power, finance, private sector, and development partners. Therefore, this dialogue is not just a forum for discussion, but a call for action. We must collectively work to scale up renewable and hybrid solutions in health infrastructure, develop innovative financing models, including public-private partnership that make energy projects in the health sector viable and sustainable, ensure that energy considerations are integrated into every stage of healthcare policy and planning. Distinguished stakeholders, the task before us is very clear. We must build a resilient health system that is powered by sustainable and reliable electricity. The Federal Ministry of Power stands ready to collaborate with the Ministry of Health, state government, development partners, private sector, civil society organizations, etc., to ensure that no Nigerian is denied access to healthcare due to lack of power. On this note, I warmly welcome all participants to this dialogue and urge us all to actively engage, collaborate, and contribute our knowledge and expertise toward crafting a sustainable power solution that safeguards the health and well-being of Nigerians. And thank you for our commitment. Wish you a very good deliberations. Thank you. Thank you.
Please give him a big round of applause. Thank you so very much, sir. Just before we go to the goodwill messages, we are a bit pressed for time, so we will really need to move really fast. But someone had told me that, MC, I like your suits, but it seems you want to do frog jump. The representative of the Chief of Army Staff is here, and I have not yet recognized him, so please pardon me. I'm not sure my knees can take frog jump at this point. In the person of Brigadier General S.O. Okoeji, the Commander, Nigerian Army Medical Corps. Please give a big round of applause for him. I wanted to tell you to stand up and wave, but I was afraid. Thank you very much. Also, the Director General of the Nigerian Governors Forum is here present. Dr. Abdul Latif Shitu is represented by Dr. Ahmad Abdul Wahab, Executive Director of Programs and Partnerships. Please, where are you? Wave at us. Oh, thank you very much. There's a saying in my place that you cannot shave someone's head in their absence. And that is why I want to specially recognize the chairman of the Committee of CMDs and MDs of Federal Tertiary Health Institutions. if we are going to fix health, we are going to start from the top and maybe from the bottom. So representing the CMDs of Federal Tertiary Institution is someone from my state of origin, Professor Mbasi. Please give him a big round of applause. And if you're asking me how Olatubosun and Basi are from the same state, see me afterwards. All right, please, if you're also the head of a health facility, please, you could just stand up for recognition. CEOs of regulatory agencies and principals of schools of health, if you're also in the room, please stand up for recognition. Let's just wave at you. Thank you very much. So without much ado, we will be going to goodwill messages. Please keep it to 1 minute. Just greet us, tell us that you wish us well, and go back to your seat because we are pressed for time. So the National President, Healthcare Federation of Nigeria, HFN, Dr. Njide Ndili, please, where are you? Please give her a big round of applause as she comes. And after her, National President, Renewable Energy Association of Nigeria, get ready for your speech of goodwill. Thank you. Please give her a big round of applause.
Good morning, all, and permit me to stand on existing protocol. I've been given 1 minute. My name is Njide Ndili. I'm the country director of Farm Access Foundation, but I'm representing today as the president of the Healthcare Federation of Nigeria. It is an honor, actually, to be part of the committee, the Power Committee. I was included in the committee after my visit to the Honorable Minister of State for Health, during which time he said to me, FMC Ebutemeta spends 120 million on diesel per month. Is there a way we can bring in investors to, provide the solution? At that time, there was a solar mission coming in from the Netherlands, and I must acknowledge the ambassador of the Kingdom of the Netherlands, who was in the room earlier. So really, I think this is a very important discussion, but more so because of private sector. Representing the Healthcare Federation, which is the private sector coalition trying to support government to improve the healthcare sector. Oftentimes we're left out of the discussion. So in this discussion, we are seen as the solution provider for the healthcare alternate power, but we want to be part of the beneficiaries of the solutions provided, please. So this is really to say that we are in the room. We are suffering as well as private sector, and we want to be beneficiaries of whatever solution is proposed today. Thank you very much.
Please give her a big round of applause. You look like someone that stays on band A. Well, it's okay. So the next is National President, Renewable Energy Association of Nigeria, represented by the Vice President, Mrs. Demilola Ashale. Please give her a big round of applause to encourage her to walk up. Please, ma'am. Thank you. Clap for her to encourage her, please. Thank you.
Okay. Good morning, everyone. Your Excellency is standing on existing protocol. It is a privilege and honor to bring goodwill messages on behalf of the Renewable Energy Association of Nigeria, the umbrella body of over 300 companies, innovators, and professionals driving the adoption of renewable energy across our nation, Nigeria. I would like to begin by commending the Federal Ministry of Health and Social Welfare and the Federal Ministry of Power for convening this first National Stakeholders Dialogue on power in health sector at this very crucial time. We are here not just to talk about power as technical issues, but to recognize it as a foundation of health, equity, and survival. Energy is not just about lights and machines, it is about saving lives. The Renewable Energy Association of Nigeria stands ready to partner with stakeholders in driving transformation of power in the health sector. Our commitments are clear. We will continue to work with government agencies to design and promote enabling policies and incentivize renewable solutions in the healthcare. RIAN is uniquely positioned to bridge partnerships between public and private sector, technology providers, financiers, and health institutions to accelerate impact. As the Renewable Energy Association of Nigeria, we reaffirm our readiness to collaborate. Together, let us light up Nigeria's hospitals, clinics, strengthen healthcare delivery, and secure elder futures for generations to come. Thank you.
Thank you very much. If you see the look she gave me, say, this man, allow me talk. I flew aeroplane to come here. Okay. Without much ado, would like to invite the country director for World Bank, represented here. Let me allow him call his name, please, before
I genuinely feel that my parents gave me a twisted name exactly for this moment. So, good morning, everyone. My name is Vinay Vutkuru. I'm actually the acting country director for the World Bank now, because my country director is away. Please allow me to stand on the existing protocols, given the limited time, but I would want to recognize the Honorable Minister for Health. He's one of our own, the former Global Director of Health at the World Bank. Ladies and gentlemen, the World Bank is really excited to be part of this, I would say, groundbreaking initiative to discuss and offer solution to address the really kind of recurring power challenges in the Nigerian health sector. I think I really want to emphasize that this gathering, which really brings together public, private, and development partners and civil society partners to come together and really come up with innovative solutions, really shows the profound commitment of the President to the health and well-being of Nigerians, and it recognizes that reliable power is foundational to resilient healthcare delivery. So we really commend the leadership of this nation for this. It's clear that the availability of reliable and clean electricity to healthcare institutions is almost central to improving efficiency and effectiveness in healthcare delivery. Allow me to give 3 specific examples of how the World Bank is supporting the government of Nigeria in this really important effort. The first example is how through the Nigeria Electrification Program, the World Bank supported the government of Nigeria in electrifying 100 health centers, and this is spread across all 36 states of Nigeria, and also 2 university teaching hospitals. And early testimonials from these interventions indicates that medical staff are staying for longer hours, patients are accessing health services at the facilities have also increased, and there's reduced infant and maternal mortality. This shows that power is so critical to health service delivery. The second example is the Impact Project. This is a $650 million credit from the World Bank, and it supports Nigeria's goal of improving utilization and quality of malaria, immunization, reproductive and maternal neonatal child health services in Nigeria. And under this project, the government is providing renewable energy for over 2,000 primary healthcare facilities nationwide. The third example I'd want to share is, again, it's a $750 million program called the DARES. And through this program, we're supporting a pilot in Lagos State of yearly using a distributed PV or solar rooftop system to provide really health services. I just want to conclude that the World Bank really remains committed to supporting Nigeria's journey, believing that together we can transform today's power challenges into tomorrow's opportunities for every citizen. All the very best wishes.
Please give the World Bank a big round of applause. And I know what some of you are thinking. You're like, Dr. Kola, why did you allow it's the World Bank? please allow World Bank to speak. Another round of applause for World Bank. To represent the UN agencies, I think WHO will be doing that, and the country rep for WHO is in the room. Please give him a big round of applause. Dr. Alex Basasira. Thank you.
Thank you very much. Your Excellencies, allow me to stand on existing protocols. On behalf of my colleagues from the United Nations, we are very privileged to join you today as Nigeria continues to take bold steps to strengthen the health system, including through sustainable energy solutions. The United Nations recognizes that Nigeria, as many other African countries, energy gaps continue to hinder progress towards universal health coverage and health equity. It is for this reason that we commend the federal government for convening this dialogue, which reflects Nigeria's commitment to intersectoral collaboration. The theme, Powering Health Through Public-Private Synergy, rightly emphasizes that no single actor can solve this challenge alone. We at the United Nations reaffirm our commitment to this agenda by supporting evidence generation, policy development, partnerships, and the provision of technical expertise. We congratulate the government and all her partners for this bold initiative and urge collective action for the health and well-being of all Nigerians. Thank you.
Please give him a big round of applause. There's a state in Nigeria that consumes more than half of our power. So if we can solve that state, I think Nigeria will be fine. Ladies and gentlemen, for the goodwill message is the Lagos State Commissioner of... You knew I was talking about Lagos. The Lagos State Commissioner for Energy and Mineral Resources, represented by the General Manager, Lagos State Electrification Board, Engineer K. Balogun. Please give him a big round of applause. We cannot be talking about power in Nigeria without Lagos. We generate more something. Lagos has swallowed it, so please give him a round of applause. Thank you.
The President of Nigeria, ably represented by the Secretary to the Federal Government, the Minister of Health and Social Welfare, the Minister of Power, the Minister of State for Health. Ladies and gentlemen, permit me to stand on the already established protocol. On behalf of Lagos State Government and Ministry of Energy and Mineral Resources, I am honored to join you at this important national stakeholder dialogue on power in the health sector, convened by the Federal Ministry of Health and Social Welfare and Power. This dialogue is timely. It focused on an issue that directly affects the health, safety, and well-being of every Nigerian. A dialogue on power is more than a discussion about electricity. It is about how energy drives progress. In the health sector, reliable power is not a luxury, it is a lifeline. It makes advanced medical procedure possible. It preserves vaccine. It powers emergency response equipment, and it keeps hospitals safe for patients and staff. This gathering is a unique opportunity for governments, the private sector, development partners, and healthcare professionals to design solutions that are practicable, scalable, and sustainable. Together, we can move from an unreliable power landscape to one that is resilient and life-saving. As we deliberate, let us remember, the true measure of success is not in policy and projects, but in the life saved and in the improved health outcome made possible through reliable power. I commend the federal government for this initiative and affirm Lagos State's commitment to collaboration and innovation in powering healthcare delivery. Thank you.
Please, let's give him a big round of applause. The statement that stood out for me is when he said the true measure of the success of what we are doing today is not in the policy document or the slide deck, but in the number of lives saved by what we are going to do here today. Another round of applause for him. I would like to call to the microphone the chairman of the Nigeria's Health Commissioners Forum and the Honorable Commissioner for Health in Ekiti State, Dr. Oyebanji Filani, for his comments. Please, a round of applause for him.
His Excellency, the President, Federal Republic of Nigeria, ably represented by the SGF. I call him the GSS, two-time governor, two-time senator, and now secretary to the government of Nigeria. The Honorable Minister of Health, time 100 influential, the first-class brain in the Ministry of Power, our amiable Honorable Minister of State for Health, MNI, Permanent Secretary, my own dear sister, PS Power, who used to be in health as well. We recognize you and appreciate you. Thank you for being here. The representative of the head of service, representative of Chief of Army staff, heads of federal MDAs present, MPH, CDA, NHIA, NACA, and the rest of them. Of course, CMDs ably represented by one-time Commissioner of Health as well. My own very super colleagues who are all present. Honorable Minister, as you can see, those who know where the shoe pinches, thank you all for being here. Every other distinguished persons, the UN agencies, World Bank, and of course we must acknowledge every member of the committee that has put this together. The PS had a very good speech. I hope that you're able to share it, so I probably wouldn't need to say anything any longer. But I'll speak to just three things very quickly. The first is that in 2021 in Ekiti State, we renovated some of our facilities, and part of what we did was to put renewable energy in the secondary facility. It wasn't big, I think about 15 kilowatts. But after that was done, I recall, and this is something that has always stayed with me, what the CMD said. He mentioned and said, Honorable Commissioner, we used to spend a little under 2 million every week on fuel. Now we do not do that any longer. But beyond that is that we have many more people coming into the facilities. Our surgeries and our outpatients is much faster. There is the health implication, but there is also the economic implication of that. And I think that's the importance of today, that we have the relevant persons, and this brings me to my second point, all relevant players in this room today. We have the Ministry of Power, we have the Ministry of Health, we have the SGF, we have members of the private sector, we have leaders at the subnational who have the responsibility to help push this, the CMDs are here, and all the different players. And like everyone has said, if after this we can't get it right, then maybe all of us should really not be in this space again and maybe go to Benin Republic and just leave, this for others to do. But I do believe that we will get it right. The commitment is there, and we must thank His Excellency the President for helping to ensure that the drive and the push is on this. So I really look forward, on behalf of all my colleagues, to not just the end of this program, but the outcomes and the long-lasting impact on every primary health center, every secondary health center, every tertiary institution, public and possibly private, that gives us the opportunity as a country to ensure that 24 hours we have light, whether a woman is to deliver at 2 a.m. or at 2 p.m., that it would not be said that, oh, we could not get the autoclave to work because there's no power. Or the surgery lights are not on because there's no power. So I look forward to the compact. I look forward to the outcome of this, and I want to use that opportunity to wish us all well. Thank you very much.
Please, a big round of applause for Dr. Oyebanji Filani for that very fantastic speech. Without much ado, we'll go to the head of the Civil Service of the Federation, and she is here represented by Mr. Kauba Danjuma Usman for some brief remarks. Please give him a big round of applause.
Thank you, Mr. His Excellency, the President of Federal Republic of Nigeria, Ahmed Bola Tinubu, ably represented by SGF, Senator George Akume. For want of time, permit me to speak on already established protocol. Mr. MC, the head of service still remain my boss, Mrs. Esther D.D.L. Walson Jack, OON MNI, who I'm representing at this occasion. May I simply read her speech? It is a great honor to deliver this goodwill message as such a strategic dialogue convened to address one of the most pressing infrastructural challenges confronting our health care system. Let me first commend the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, and the Honorable Minister of State for Health and Social Welfare, Dr. Izia Kule Salako, the Chief Convener, for their vision and leadership, ably supported by His Excellency, Mr. President. The convening of this first national stakeholder dialogue on power in the health sector is not only timely, but also a bold step toward transformational governance and result-oriented policy making. Power is quite literally the lifeblood of healthcare delivery, from vaccine preservation to surgical theaters, from diagnostics to emergency response. Uninterrupted, clean and affordable energy is not a luxury. It is a public health necessity. A hospital without reliable power is a hospital at risk. At this juncture, permit me to paint this better. Imagine a urologist carrying out a laser surgery of the prostate, and suddenly he hit a major vessel and light went out. If there is light, he will simply just stop it. Light has gone out. Before you change to open surgery, that patient is likely to die. This is what we mean without reliable and sustainable energy to your hospital, it has a great risk. As the engine room of government, the Federal Civil Service remains committed to enabling the system that drive effective service delivery through the Federal Civil Service Strategy and Implementation Plan 2025. We are embedding efficiency, professionalism, and innovation across ministries, departments, and agencies. These include fostering stronger intersectoral collaboration and advancing data-driven decision-making for sustainable development outcome. The focus of today's dialogue aligns perfectly with our transformational agenda, which emphasizes strategic partnerships, evidence-based planning, and citizen-centered service delivery. The nexus between energy security and health sector performance is a clear reminder that integrated thinking must guide our reforms and policies. Let me assure the Office of the Head of Civil Service of the Federation stands ready to support the actionable outcome of this engagement. We are committed to strengthening institutional frameworks and enhancing interministerial coordination so that the reforms we agree upon here will not remain words on paper, but translate into lasting improvement in our health system and beyond. Distinguished ladies and gentlemen, the challenge before us is not only to share ideas, but to match them with the will, capacity, and institutional resilience required to deliver change. Talk must lead to action. Only then can we guarantee a health sector that is resilient, reliable, and never held hostage by infrastructural gaps. Thank you, and wish all of us fruitful deliberations and impactful outcome.
Please, let's give him a big round of applause. Our discussion here is not just policy, it's about lives we are going to save. Last but not the least, and we really implore us to keep it to time because we are behind schedule, is the Director General, Nigerian Governors Forum Secretariat, Dr. Abdulateef Shitu, represented by Dr. Ahmad Abdul Wahab, for his comments. Thank you. Please give, all the governors sent him here, so please give him a big round of applause.
Thank you very much. His Excellency, the President of the Federal Republic of Nigeria, ably represented by the Secretary to ably represented by the SGF, who also used to be a member of the NGF, so what I need to specially recognize him. The Coordinating Minister of Health, the Minister of State for Health, the counterpart of the Minister from Power. Let me align myself with the already established protocol and say good morning to everyone. So I'm representing the Director General of the Nigerian Governors Forum, and he sends his apologies of his inability to be part of this. But he gave me 4 messages that he asked me to deliver. The first message is the Secretariat is very happy about this convening, and the DG is very happy to note the array of stakeholders that have been invited, and is particularly happy to see that we have a very good representation from the subnational level. The second message that the DG asked me to deliver is that the issues that have been discussed is very appropriate, because we know that availability of regular power is critical to the function of health facilities. That is why the Secretariat is fully behind the discussions that is happening today. The third message from the DG, it's as we try to set up the alternative energies and ensure that we have regular power, it is important that we have a robust post-installation monitoring framework that should also include a planned preventive maintenance so that whatever we install will actually live to their full lifespan. And the final message is to once again commend the Federal Ministry of Health and the Federal Ministry of Power for putting this together, and to assure that the governors at the next NGF meeting. Thank you once again for the invitation.
Please give the representative of the NGF Secretariat a big round of applause. As I think Dr. Banji Filani said, if the people in this room cannot fix power, the Honorable Minister is looking at me, it will not be fixed. That's why the corollary is that if power will be fixed, then it is the people in this room that will fix it. Let's give ourselves a big round of applause in anticipation. Before I invite the Honorable Minister of State for his comments, I want to just acknowledge all our participants online, irrespective of where you are participating from all over the world. We welcome your comments. Please keep them coming, and we do hope that you participate fully. Ladies and gentlemen, this is crunch time. I've been part of some of the meetings as maybe an outsider to the ministry, but the level of intellectual bandwidth that has gone into this event, is something that is quite remarkable to see. And as a Nigerian, I'm very proud that that level of conversation and policy ideation is going on in our federal ministries. And for his comments to speak about this fantastic initiative is the convener himself. Ladies and gentlemen, please welcome with me, with a big applause, welcome the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Kunle Salako. I need the applause to be more resounding. Thank you very, very much. Thank you.
Thank you very much. Time is fast spent, but I must recognize very specially my boss, the President and Commander-in-Chief of the Armed Forces, Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, who is here represented by another boss, our class monitor, the Secretary to the Government of the Federation, Senator George Akume, CON. I must also recognize the coordinating minister who has been coordinating us very, very effectively, Professor Muhammad Ali Pate. Let me say that the coordinating minister attached so much importance to this dialogue that he has facilitated a 4-day training for myself and the Minister of Power over this issue. And we're going to be going to Harvard to learn some lessons around how to implement it. So thank you very much, Honorable Coordinating Minister. The Minister of Power, my dear brother, Chief Adebayo Adelabu, FR. Let me also specially recognize the head of service, who is here represented by Doctor himself, the Permanent Secretary, CSO, Permanent Secretary of Health, Permanent Secretary, Power, our honorable commissioners, both for health and for power and energy. When I did a count, I think we have in the neighborhood of about 20 commissioners here represented, or here personally. So I want to thank you, honorable commissioners, for turning out so well. Director General of the Nigerian Governors Forum here represented, directors of the ministry, our partners, World Bank, WHO, Global Fund, NGOs. Let me also specially recognize the National President of National Association of Private Medical Practitioners. It is important that I recognize them to convey the message that this is across society dialogue. The members of the implementation committee, especially all of you, but let me use Dr. Babatunde Ipaye, the vice chairman, at the point of contact to recognize all of you for your hard work. When I came this morning, I saw that some of you probably did not sleep overnight. Thank you very much for the work you have done. Gentlemen of the press, distinguished ladies and gentlemen, it is a unique pleasure and honor to address this gathering of esteemed stakeholders at this crucial engagement, bringing together the health and power sectors in a bid to lay the right foundation and take progressive steps towards the attainment of energy sufficiency and sustainable electrification of our public and private healthcare facilities in Nigeria. Since I assumed office as the Honorable Minister of State for Health and Social Welfare about a year ago, I have conducted working visits to many of our federal tertiary institutions in different geopolitical zones of the country, and also interacted with heads of health facilities at subnational level and also in the private sector. These familiarization visits and interaction has given me the opportunity to be directly exposed to the challenges being faced by our health institutions, a major one being the deficit in electricity provision and the huge energy costs that they have to bear every month. This finding is in consonance with the result of a survey carried out by Budget It, where health workers identified access to reliable electricity as the second leading barrier to improve healthcare delivery in Nigeria. Our health system are not only underpowered, they are not efficiently powered. A survey that was conducted by the Sustainable Energy for All in 2021 showed that 40% of the functional PHC facilities in Nigeria do not have access to electricity, with the majority of the remaining 60% receiving not more than 10 hours of power daily from various sources. A rapid assessment that we carried out earlier this year showed that federal tertiary health institutions requires between 3 to 8 megawatts of energy to function optimally. The institutions receives an average of 5.3 hours of daily electricity from the national grid. They have installed backup capacity of between 0.8 to 3.3 megawatts, which is about 50% backup of their need. And this backup is generated about 80% through diesel engines, spending close to 80 million in some cases per month to pay for power. 20 to 50% of the operating expenses in our federal tertiary health institutions goes into purchase of fuel. This situation is not different in the private sector, with 30% of respondents to a survey conducted in April 2025 by the Healthcare Federation of Nigeria reporting spending 5 to 20 million naira on electricity monthly. Findings has also shown that there is limited coordination between energy and health sectors actors, resulting in multiple facility electrification data sets and duplication of interventions. This scenario has resulted in suboptimal service delivery by the healthcare system, with resultant reduced access to care, compromised quality of treatment, and poor health outcomes. Service has been disrupted, public health compromised, Nigerians subjected to hardships, and many lives lost due to poor electricity supply. The summary is that energy supply has become a major disruptor of health services in our country. It has become an emergency that we must address if for all the healthcare reforms and investment being made will achieve the desired result. Let me be emphatically clear that in attempting to solve this power issue in our health facilities, we are not starting from ground zero. The federal government has risen to the challenge through various initiatives, including the ongoing efforts to electrify selected PHCs in the country. The Ministry of Power, through its agencies, like the Rural Electrification Agency, has also made commendable progress, deploying 100 containerized solar hybrid systems to health facilities across Nigeria. We also have the Energizing Education Program, which is benefiting selected teaching hospitals like the University of Maiduguri Teaching Hospital and the University of Calabar Teaching Hospital. The European Union has also launched the Nigerian Solar for Health Program, aiming to provide 24/7 power supply to 45 health facilities across 5 states, while Doctors Without Borders has been instrumental in introducing solar power in healthcare facilities in northern Nigeria. All this demonstrates how solar can assure stable operations for medical devices and cold chains even in challenging environments. These examples demonstrate that transition to greener energy in our health sector is not merely a distant dream, but a tangible reality with proven benefits. They provide valuable lessons and models for replication and scaling across the nation to address the challenge of health facility electrification in our country. Despite these efforts, however, our health system in Nigeria is still faced with significant energy challenge with frequent media reports of outages and blackouts, sometimes for weeks, in our hospitals. The effort to resolve the power and health challenge are also not happening at the rapid pace that is required and is not being delivered at scale. Thus, the need for a rethinking of the model. The current situation requires a collaborative, whole-of-government approach as we work across sectors to resolve many challenging issues that are beyond the purview of the health sector. In the face of dwindling overseas development assistance and the realization that public sector funding may not deliver health facility electrification at scale, mobilizing social impact investment and other innovative funding from private sector that will protect the social good agenda of the health sector has become compelling. The potential environmental impacts and the reports of fire incidents, battery malfunctioning, and other operational maintenance problems in some health institutions that have embarked on alternative energy projects also requires front-load thinking and attention. Ladies and gentlemen, we can no longer afford business as usual in the face of service interruption, patients' dissatisfaction, and mounting energy bills in our hospitals. The time has come for us to jointly take stock and put all hands on deck to address the access and quality limiting effects of energy poverty in our health sector, and also relieve our hospitals of the burden of prohibitive cost of power supply, which costs hundreds of millions of naira monthly. As we all know, energy is the lifeblood of modern healthcare, from powering essential medical equipment and maintaining cold chains for vaccines, to ensuring lighting for emergency services and providing comfortable environment for patients and staff. And uninterrupted power supply is non-negotiable. Without reliable electricity, we cannot significantly improve our national health facility quality of care score. Our reforms to enhance quality of service, digitalize operations, unlock healthcare value chain, and ensure health security cannot be optimized except there's a guarantee of reliable, efficient, safe, affordable, and cost-effective electricity supply in our health system. This is therefore the time to be creative and innovative as we move to develop and adopt smart energy solutions that will strengthen our health systems and empower us to deliver on our core mandate or improving population health outcomes. It is against this background that in March this year, the Federal Ministry of Health and Social Welfare inaugurated a multi-stakeholder committee of experts cutting across government, private sector, development partners, the civil society, and service providers with 6 key objectives. Today, the committee is delivering on one of its major deliverables, the dialogue. And I welcome every speaker, panelist, investor, policymakers, practitioners to this important gathering. I welcome you with optimism and confidence that in these 2 days, the objective of this dialogue itself will have been met. The stakeholder engagement is expected to leapfrog the development of a national collaborative plan of action to comprehensively address the power challenge that continues to constrain healthcare delivery in the country. This dialogue is a testament to the collaborative spirit of the federal government and a reflection of the commitment of President Bola Ahmed Tinubu, GCFR, that Nigerians must have access to affordable and qualitative healthcare in the journey towards universal health coverage. In the spirit of Renew Hope agenda, we must therefore continue to forge a path forward, leveraging innovation, collaboration experience, and strategic investments to ensure that every Nigerian health facility is adequately powered to deliver quality care. Your Excellencies, distinguished ladies and gentlemen, the Health Sector Renewal Investment Initiative, the operationalization of the Renew Hope agenda in the health sector, is headed in the right direction and moving steadily to transform healthcare in our country. The challenges facing our healthcare system are numerous, but their being accurately diagnosed and solutions being provided in a collaborative and inclusive manner to better assure across government and across society ownership. Consequently, one key expected outcome of this dialogue is the signing of a compact for the sustainable electrification of public and private health facilities in Nigeria to serve as the documentation of our shared vision in this journey. The Federal Ministry of Health and Social Welfare, in collaboration with the Federal Ministry of Power and other stakeholders, is committed to putting together an implementation mechanism to ensure that this dialogue will not just end as talk. The magnitude of the undertaking we are pursuing today requires heavy financial resources in a sustainable financing manner. While the initial capital outlay for renewable energy installations tend to be substantial, the long-term benefits, including reduced operational costs and improved service delivery, far outweigh this upfront investment. In the next 2 days, we must explore and come up with concrete and diverse financing models to attract the necessary capital and ensure the viability of these projects. I call on impact investors, the capital market, philanthropists, foundation, our development partners like the World Bank, European Union, etc., to step forward to take the challenge to support this initiative and let us work together to make a difference. Before I end this address, let me, on behalf of all of us in the health sector, appreciate the priority attention the health sector has been receiving under President Bola Ahmed Tinubu, which is slowly and steadily taking Nigeria on the path to universal health coverage. The President, in the last 2 years, without doubt, has demonstrated unparalleled political will, executive determination and commitment that are impacting positively on the health sector. From increased budgetary funding, innovative executive orders, practical initiatives, and groundbreaking pronouncements, the health sector is being placed squarely at the center of the Renew Hope agenda implementation. Thank you. I am grateful to the Honorable Minister of Power for his commitment to intersectoral collaboration as he joins hands to confront and resolve the numerous challenges of NLV provision that have been a burden to our healthcare facilities across the country. I recognize and commend other federal government agencies, our state government, ably represented by the commissioners, development partners, private sector players that are part of this effort. Let us use this coalition to work together for cross-sector coordination and put in place a policy and partnership framework that is conducive for better planning, efficient implementation, and a result that will energize Nigeria's health sector for the future and serve the health of the people. And so, with peace and plenty, Nigeria shall be blessed. Thank you for your attention.
Please, that speech deserves a better applause. Thank you so very much, the Honorable Minister of State, for that compelling speech. I saw a lot of you shaking your heads and nodding in agreement as to the brilliance of what he was saying. Please, another round of applause for him. That was such a brilliant speech. Thank you so very much. Imagine the policy clarity at the highest levels of governance in Nigeria now. It gives cause for optimism, and we are sure that in our lifetimes, in a time not too far in the future, we shall have uninterrupted power, not just for health, but everywhere, and we'll no longer shout up NEPA in Nigeria. If you believe it, say, When they call you the Minister of Power, I don't know how, you must have power. True or false? We have all been talking about the critical nature of power to in quote, power everything. And someone has been put in charge of that in this country. Ladies and gentlemen, for a speech, I would like to invite the Honorable Minister of Power. Notice how I'm calling the power. The Honorable Minister of Power. Ladies and gentlemen, invite to the stage Chief Adebayo Adelabu. Please give him a powerful hand clap. Everything has to be power. You can notice my voice has increased in its power now. Thank you very much.
The President, Commander-in-Chief of the Federal Republic of Nigeria, President Bola Ahmed Tinubu, GCFR, ably represented by our leader, our mentor, and an astute administrator, His Excellency Senator George Akume, CON. Thank you so much for joining us. Your Excellency, the Coordinating Minister of Health and Social Welfare, Professor Mohamed Pate, the Honorable Minister of State for Health and Social Welfare, my dear brother, Dr. Lakunle Salako, the Chairman, Senate Committee on Power, and his counterpart, Senate Committee on Health, the Chairman, House Committee on Power, and the Chairman, House Committee on Health, Honorable Commissioners for Health and Power from the states, directors, the Permanent Secretary of the two ministries, Ministry of Power and the Ministry of Health and Social Welfare, representative of the Head of Civil Service of the Federation, all the directors in the Ministry of Health and Social Service and the Ministry of Power, all heads of government agencies here present, CMDs of health institutions, our development partners from the World Bank and the United Nations, esteemed stakeholders from the power and health sectors, gentlemen of the media, distinguished ladies and gentlemen. For whatever I've missed out, I also crave your indulgence to rely on the already established protocol. Thank you for that. It is my honor and privilege to welcome you all to this landmark event, the first National Stakeholders Dialogue on Power in the Health Sector. Today marks a critical step in our collective efforts to strengthen the link between reliable energy access and the delivery of quality healthcare services in Nigeria. The relevance of this National Stakeholders Dialogue cannot be overemphasized, as it provides us with a unique opportunity to focus on the intersection of two critical sectors, power and health. By bringing out collective expertise to the table, we can chart a path that strengthens healthcare delivery by ensuring sustainable, reliable, and affordable electricity supply to facilities across Nigeria, from the primary health care centers in rural communities to the teaching hospitals in urban centers, so they are fully equipped to serve the needs of our people. Equally important, today is proof that Nigeria is ready to approach development differently. Too often, our sectors have worked in silos, each pursuing their mandates independently. But the challenges facing our nation, whether in health, whether in education, or infrastructure development, are interconnected and interwoven. Without reliable power, health systems cannot function effectively. Without a healthy population, productivity and economic growth cannot be achieved. Electricity or power supply is actually the lifeblood for any economic growth and industrial development. And it actually cuts across all critical sectors. It's a common denominator, both in developing countries and in the advanced world. There is no critical sector that can perform optimally without stable, reliable, and functional energy source. Not just in health, even in education, in every facet of our daily lives. So it cuts across. By bringing together the power and health sectors, we are sending a clear message, which is CCP, collaboration, cooperation, and partnership. It is no longer optional. It is essential. We should stop working in silos. We must collaborate, we must cooperate, and we must partner to achieve a desired end. This partnership between both ministries strengthens the support of the development partners and private stakeholders. Is the model we must replicate across other areas of governance, because collaboration is how we turn policies into real impact for our people. To your excellencies, the coordinating Minister of Health and Social Welfare, Professor Mohamed Ali Pate, and the Honorable Minister of State for Health and Social Service, Dr. Ishaq Adekunle Salako, I say a big thank you for also enabling this cooperation between our ministries. Thank you so much for that receptive hand. The renewed hope agenda of Mr. President clearly identifies access to power and access to quality health care as top national priorities. By empowering health care, we are advancing both priorities at once. It's like using one stone to kill two birds: the stable power priority and the health sector priority. This dialogue is therefore a practical step in operationalizing Mr. President's vision on human capital development, infrastructure renewal, and social inclusion. And let me state at this point that Mr. President has done his part. He has given us the conducive atmosphere to allow every sector thrives. What we are having today would not have been possible if not for that. And I will make mention of just 3 items before I continue with my speech. Number 1 was the signing into law of the Electricity Act of 2023. That was the first bill Mr. President signed immediately he resumed in June 2023. And that is what makes this possible. Why? That bill has 2 important aspects. Number 1 is the decentralization of the power sector. For all of us here, we all know that between the independence and up to 2023, the sector has been over-centralized. We used to know the Electricity Company of Nigeria, ECN, in the 60s. We all knew about the National Electric Power Authority in the 70s up to late 90s, which transformed into the Power Holding Company of Nigeria in the early 2000s up to 2013. All these were centralized government agencies. For a country that is as huge as almost 1 million square kilometers of landmass, of over 200 million people, of 36 states plus the FCT, of 774 local governments, of almost 10,000 wards, centralization can never work. So with this act, power sector has been decentralized. We never used to have commissioners of energy in the states. Today, the sub-national government can participate fully in operationalizing the power sector in all segments of it, from generation to transmission to distribution. Even ministries now today are able to do that because of this singular act of Mr. President. Otherwise, everything would have been concentrated at the federal level. Even local government today are allowed to. That is the decentralization. Then the second aspect is the liberalization. Power sector is no longer government business. It's no longer government sole business. The kind of investment required to transform or reform this sector can never be provided by the federal government alone. There are competing needs in other critical sectors in federal government. We have works, road construction across, bridges, we have education, we have health, we have defense, we have all other sectors that are competing for limited funds. So thinking that government can fund the power sector 100% is not valid. So we must catalyze private sector investments. We must include development partners, the World Bank, the AFDB, the AFD, the JICA, all of them must take part. And today, we are achieving that. There are now a lot of private sector investments in the private sector, in the power sector. The World Bank are more active than ever. African Development Bank, the same thing. Japanese National Cooperation Agency, the same thing. The German GIZ, the French Development Agency, AFD, the same thing. And even the number of private sector renewable energy firms today, they are uncountable. It wasn't like that before. It was because of this Electricity Act of 2023. So I think we need to applaud Mr. President for giving us that conducive atmosphere to enable us all to participate in this power sector that requires all hands to be on deck. Then the issue of policy. There was never a coordinated, comprehensive, integrated national electricity policy in this country in the last 21 years. So the ministry has been able to put something together that is now called the National Integrated Policy on Electricity in Nigeria, which has defined the functions of all stakeholders in this sector, the role anybody can play in this sector. Whoever wants to bring in money to invest here, they know their limitations, they know the opportunities available. So that has also helped to revitalize this sector. The number two from Mr. President is the approval for the energy transition plan for the country, which is targeting the carbon neutrality by year 2060. This has allowed us to embrace our distributed renewable energy concept, the DRE, that will achieve two things. Number one, it will achieve reliability of our power supply. Number two is the fact that it will also eliminate pollution of all forms. The intention is to eliminate fuel and diesel generators, which is also not good for our health. So you can say that the power and health are actually interwoven, and we are pursuing this one diligently. We have a midterm plan of year 2030, by which time 30% of almost 30,000 megawatts of power should come from renewable energy. It is called Vision 30-30-30. And we are on course to achieve the 2060 carbon neutrality or net zero targets. And lastly on that is the cost dilution. Majority of the health sectors are no commercial businesses. They are social institutions. It is tough for them to afford the high cost of providing electricity. Let's even forget the issue of diesel and fuel generators, where teaching hospitals incur average of 30 to 50 million on a monthly basis. That is grossing almost 600 million in a year. Where do we expect them to get such allocation? Even the grid, the cost of grid electricity provision is also not affordable to these social institutions, whether at tertiary, at secondary, or primary healthcare level. So the introduction of renewable energy will also achieve some level of cost dilution. Between 7 a.m. in the morning till 7 p.m. in the evening, our institutions should be on solar source of energy. And I said something in Accra last week. We attended the International Solar Alliance, where we signed a country support partnership with ISA of India. I said, solar is meant for Africa. Solar source is for sub-Saharan Africa. In fact, it's made for Nigeria. There is no state in Nigeria today that is not guaranteed minimum of 8 hours of sunlight. We have some extreme, whereby we have 12 hours of sunlight. What do you need again? Even in Europe, where they don't have such long hours of sunlight, solar is effective. Both solar home systems, interconnected mini grids, off-grid solutions, and even utility scale solar energy. Till today, our grid source of power are still two: hydro and thermal. A country with such opportunities for sunlight. We don't have solar input into our grid electricity, which is, in fact, is something that we should not even talk about. So we are working on that. So that will dilute the cost for these institutions. And I also believe that currently, the Federal Ministry of Power, through the Rural Electrification Agency, is deploying solar hybrid mini grids, standalone solar home systems, and other innovative solutions to electrify hundreds of healthcare centers across the country, which has been alluded to by the World Bank Acting Country Manager and my dear brother, Dr. Salako. Rural Electrification Agency, REA, deployed 50 kilowatt solar mini grid solutions to about 100 healthcare facilities across the country during the COVID-19 pandemic, ensuring that critical health centers had uninterrupted power supply to preserve lives, support medical staff, and sustain essential services at a time of unprecedented national emergency. In addition, through the Energizing Education Program, EEP, of the Rural Electrification Agency, we are deploying solar hybrid mini grids to teaching hospitals across the country. We have plans for 37 teaching hospitals, but today we have commissioned a 12 megawatt system at the University of Maiduguri. I think I saw the VC not long ago. Yes, I think it was somewhere around. I personally commissioned this, and it's working perfectly. In fact, they are not using more than 5 megawatts out of 12 megawatt that we installed. They have now started even supplying energy to nearby institutions. Now, there is a 7 megawatt system at the University of Calabar Teaching Hospital, which is also effective and is working. And the last approval of the Federal Executive Council about 2 or 3 weeks ago, we have approved for University of Ibadan, for University of Lagos, for Obafemi universities, and a couple of other institutions. All I want to say today is, why did we have to wait till this time? Why did we have to wait till this time? Rome was not built in a day. But if we have been taking this kind of significant steps in the past, we will know where we'll be today. But I believe it is better late than never. Let's thank President Tinubu. In addition, these deployments are not only providing reliable, clean power, but also helping to properly segregate electricity supply for clinical activities from that of residential and commercial activities within the hospital environment, with accurate metering in place. This ensures that non-medical businesses do not hide under the hospital's electricity allocation and make energy bills unaffordable. This is very, very key. There was a time UCH in Ibadan, which is my home base, had issues, lingering issues for months. And I got in there. We did our research, we did our study, and we found out that even in the teaching hospital campus, non-medical activities were like 70%, and they were hiding under clinical activities. And they are putting the bill, the burden of the bill, on the hospital. It is not possible. And that was because there was only a single metering for the entire teaching hospital. We said, no, we have to break this down. There must be appropriate metering. Let clinical activities be metered separately. Residential activities, even for the doctors, be metered separately. Business activities within the hospital premises be metered separately. There were shops where they sell ice blocks. They make ice blocks. There were bars, drinking joints. There was a particular business too that was consuming so much power. Dry cleaning business all over the place. And all of them were actually putting their bills on the hospital. The same thing happened in the University of Benin, where I also intervened between the Benin Electricity Distribution Company and the University of Benin itself. So we must go to all these institutions and cleanse them of such obstacles and hindrances that can ensure reliable and affordable electricity. So with accurate metering in place, I think I've taken this, the hybrid model further allows for an optional mix of renewable energy and grid supply, thereby reducing costs while guaranteeing sustainability. Uninterrupted electricity for clinical medical operations. By blending renewable energy with grid supply, hospitals are shielded from the high costs and unreliability that come with depending solely on grid electricity and diesel generations, enabling them to achieve a more stable, predictable, and affordable energy expenditure. These interventions have delivered measurable impacts, from vaccine storage facilities, which are now functional in remote communities where electricity was previously unreliable, to maternal and child health services, which are improving in rural areas because doctors and midwives can now conduct deliveries at night with reliable lighting and powered medical equipment, to cold storage for essential medicines, which is now possible even in off-grid locations. And emergency services are no longer constrained by darkness or unreliable power supply. Your Excellencies, these are not abstract achievements. They represent real lives being saved, communities being empowered, and healthcare being brought closer to the people. The work of the Rural Electrification Agency demonstrates that sustainable, renewable energy solutions are not just viable but scalable. What we have seen is in this pilot project must now be expanded nationwide. We need to expand it. Yes, all these pilots, all this proof of concept that we have agreed that the way to go is distributed renewable energy. We must now extend it and deploy it to all tertiary, secondary, and the primary health institutions. The Federal Ministry of Power, under the renewed agenda of His Excellency President Bola Ahmed Tinubu GSFR, is further committed to working with the Ministry of Health and Social Welfare to ensure that no hospital, no primary healthcare center, and no diagnostic laboratory is left in the dark going forward. That is our commitment. We will harness renewable energy, distributed generation, battery storage system, and grid expansion to provide the reliable power backbone that the health sector desperately needs. Ladies and gentlemen, this commitment is clearly for the health sector today. We have our open arms to receive every other critical sector that are paramount to transform the lives of Nigerians for better. The work of the ministry is not on standalone. We now work jointly with every other ministry that is ready to cooperate with us and change their lives. The task before us in rounding up is both urgent and achievable. We must scale up electrician projects for healthcare facilities nationwide. We must strengthen the policy frameworks that make investment in health sector electrification attractive and sustainable. Your Excellency, the Coordinating Minister, this is very important. We need to catalyze private sector investment for this to work. And they must see a line of sight on how they can recover their investment and the returns on this investment. So we must expand financing structures that blend public funding with private capital and donor support. Most importantly, we must institutionalize collaboration so that no facility, no community, and no Nigeria is left behind. This is not just about powering buildings. It is about powering hope, powering dignity, and powering the future of our nation. In closing, I will once again thank His Excellency President Bola Ahmed Tinubu GSFR for his leadership, for his support, and for his vision to achieving sustainable development across all sectors in the country, especially the power sector. The support has been tremendous. We know all that we passed through last year, the instability of the grid, the epileptic supply, the pain of tariff increase. Since December last year till today, 10 months and still counting, we have never recorded a single grid collapse. Thanks to Mr. President. I want to also thank the Honorable Minister for Health and Social Welfare, the Coordinating Minister, as well as his Minister of State, for upholding the ideal of Mr. President's renewed hope agenda through this collaboration. Our development partners, the World Bank, WHO, AFD, GIZ, JICA, all of you together, and all other stakeholders represented here for your commitment and for your interest in seeing our country through. And they say that if you want to walk very, very fast, you can walk alone. But if you want to go very far, you walk together. You have demonstrated that you want to work together with Africa, with Nigeria. We appreciate it. So let us have this dialogue, not only with good ideas, but with renewed determination to implement them. Let today mark the beginning of a new era where every health facility in Nigeria, no matter how remote, has the electricity it needs to deliver life-saving services. Thank you, everyone. I'm happy to be part of this, and I believe you are also happy. God bless the Federal Republic of Nigeria. Thank you very much.
Please, can we give the Honorable Minister of Power a powerful applause? You could literally feel his passion in the submission he was given. And it's a speech, but at the same time, it's a master class in what has been going on in the power sector. And there is cause for optimism. Thank you so much. The Honorable Minister of Power, Chief Adebayo Adelabu. He mentioned something that solar is for Nigeria. I served in Bauchi State. There's someone in front of me here also from Bauchi State. I won't tell you his name. Solar is indeed, if you have had to trek the street of Alkaleri, you will know that solar is indeed for Nigeria. The sun there is like it's closer to the sun. And I am so optimistic. Thank you so much, sir. Another round of applause for that masterclass. It was such a fantastic submission. And without much ado, I'd like to, it's a privilege of mine. I've seen him on television, I've Googled him, I've seen him online. Suddenly I'm seeing him in flesh, and I'm going to make sure I shake his hand. And I will not wash that hand for like 1.5 weeks. Ladies and gentlemen, for his speech, the Honorable Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, CON, for his speech. Please give him a big round of applause. Please give him a big, big round of applause. And photographer, please shake me as I'll. Thank you, sir.
Thank you. MC, you're very kind. His Excellency, the President and Commander-in-Chief of Nigerian Armed Forces, President Bola Ahmed Tinubu GCFR, here ably represented by a distinguished statesman, His Excellency Senator George Akume, the Secretary to the Government of the Federation. Thank you, Your Excellency, sir, for your leadership, but also for representing Mr. President at this event. My dear brother, the Honorable Minister of Power, Chief Bayo Adelabu, my older brother, the Honorable Minister of State for Health and Social Welfare, Dr. Zayatun Kunle Salako. I think the head of civil service, the permanent secretaries that are here, our development partners, our financing partners, the State Commissioners of Health, the platform chair, Dr. Banji, and all honorable commissioners of health, the Governors Forum, the DGs, the Planning Committee, and everyone. May I stand on the existing protocol? A lot has been said, so I'm not going to give any long speech because I think all that needs to be said has been said. I want to acknowledge my colleague, Minister Salako, for your incredible leadership in convening this effort and for joining with the Honorable Minister of Power to actually see this through, and all members of the technical committee who have pioneered this over the last several months. I think your leadership, your grit, your focus has brought us closer to solving an important problem in our health sector. So I thank you most sincerely, Honorable Minister. Over the last 2 years, I think President Bola Ahmed Tinubu has been very clear that there are many problems in our country. The problems have been long-standing in almost every sector. But he has urged us to focus on solutions, on providing solutions. That is what we have been trying to do in the health sector. This is one more step to provide solutions for long-standing, difficult challenges. In our health system, which has underperformed relative to many other countries, in the last 2 years, we've seen the solutions transforming it day by day, from the way it's governed, to the infrastructure in the primary healthcare system, to the equipment, to the financing. Today, we're seeing power and health, to the value chain, to improving health security, to digital transformation. I think the scaffolding is present, it's been assembled, and the transformation is underway, with millions of Nigerians accessing health services that are of improving quality, and with the leadership of our hospitals, in fact, that are here. I see the CMDs are also here in full force. So Nigeria's health system is undergoing major transformation. But there are two elements that are needed for further leapfrogging of this transformation. That is power, and the second is connectivity. If we can get this power sorted, and we can get internet connectivity and the digital transformation, our health system will leapfrog. Suddenly it will be the icon on the continent, and I'm sure globally people will witness, because we have the privilege of having amazing health workers, a large country, vast footprints of human resources, financing that is being organized, the infrastructure, and if we can get the power and internet connectivity and digital elements, I think we will see major escalation in our ability to deliver services for our country, for our sub-region, and indeed for parts of our continent. And medical tourism will become a thing of the past. So I want to link this conversation to the dialogue we had last week on national health financing, for which we identified certain key interventions that will accelerate, because at the end of the day, it's money. Where's the money going to come from? And Minister of Power landed on that. The government's revenue, I think, will be insufficient to finance the expansion of power in public as well as private sector. We have a mixed economy. So where is the money going to come from? And that's where the presence of the DG of ICRC here, I don't know whether the DG is here, I think he's stepped out. The ICRC as a regulator of public-private partnership is a key partner in this, as we mobilize private capital in a well-regulated manner to be deployed in this effort to accelerate the pace. Yes, the public financing will be deployed, and yes, the development financing is going to be deployed, but we also need to mobilize private capital, and it's an important way to accelerate the pace of our transformation. So PPP is a way. So thank you very much, and I will end my brief remarks to say that we will continue to deliver those solutions, and this is one more. And Minister of State, Minister of Power, I will be there. I'm going to be the cheerleader. Thank you very much. Thank you.
Please give the
Honorable Coordinating Minister of Health and Social Welfare, collaboration that will deliver in this country is unmistakable. I feel quite optimistic. I feel quite confident that if any team of technocrats can fix power in Nigeria, this set of technocrats will fix power in Nigeria. Please, let's give ourselves a big round of applause. And with that, we have come to the end of the first part. I am not worthy to invite His Excellency the President, so I'm going to first of all invite, and I cannot thank you for being here. So ladies and gentlemen, I would like with a lot of pleasure to invite to the stage the Vice Chairman of the Dialogue Committee in person of Dr. Babatunde Ipaye to come and thank you for being such a fantastic audience. Please give him a big round of applause.
Thank you. The President and Commander-in-Chief, Federal Republic of Nigeria, President Bola Ahmed Tinubu, ably represented, the Honorable Ministers, please allow me to extend other courtesies and protocols for time. I would like to, on behalf of the Honorable Minister for Health, Professor Ali Pate, and the Honorable Minister of State for Health, Dr. Kunle Salako, I'd like to thank Mr. President for leading this from the front. I also like to, on behalf of the committee, thank the Secretary to the Federal Government of Nigeria, Government of the Federation, on their Senator George Akume CON, for your leadership, for physically coming to represent the President and leading this. Let me also thank the members of National Assembly, ably represented here today from both chambers, the Senate and the House of Representatives. I'd wanted to thank the honorable ministers, but I feel like I should just congratulate them for deciding to lead this from the front. So rather than thanking you, I want to wish you well as you lead us to providing the solutions. The head of service, thank you, Ma, and thank you for being well represented. Permanent secretaries of both ministries and other permanent secretaries here, thank you for your leadership for both sectors. I'd like to thank members of my constituency, the Honorable Commissioners here. I'm very proud to be one of you, so thank you for leading the subnationals to be very well represented. The head of department and agencies here, thank you for your support. I would like to specifically thank the Rural Electrification Agency for being very resourceful in the course of our committee assignments. I cannot but especially thank the major stakeholder I consider, the MDs of our tertiary medical centers. Thank you. Can we please appreciate them for coming in good numbers? In fact, honorable ministers were the first set of people to report at this venue today. So thank you for showing leadership. Our development partners, I would like to say a very big thank you for supporting the work that we unveiled today. We started meeting since March, your representative, the World Bank, UN agency. I'd like to specifically thank the World Bank for providing some financial support to today's program, and of course the Global Fund. WHO, UNDP also supported us in the course of our assignments. We had several meetings in the UN House. Thank you for hosting us. Our private sector partners, I can't start listing you for lack of time. but your participation, your expectation, we greatly appreciate today. I do this on behalf of the honorable ministers. The power solution providers, you've been part of us. We have also seen them exhibiting some of their great work. We look forward to working with you. The financial institution, banks, development banks, and other financial institutions in Nigeria, civil society organizations and networks, they were also very well represented in the course of bringing up this dialogue. And of course, we want to thank you so very much for participating at today's dialogue. And we also want to thank you in advance for the role you play going forward. The media are the fourth estate of the realm. You've been part of us from the beginning. You have helped us communicate today's work to the world. We look forward to working with you. And of course, all other great participants of today's event, I cannot but, thank you. But last but not the least, let me specifically thank members of my committee on behalf of the Honorable Coordinating Minister and the Minister of State. Can we stand up for recognition, members of the Coordinating Committee? So I want to thank you openly for putting this great dialogue together. Thank you all. Before he became the President of the Federal Republic of Nigeria, before he became the leader of the political movement that won the first election against the sitting government, before he became the governor of Lagos that transformed Lagos to a city that we are very proud of today, before he became the leader that liberated the Nigerian political space through political activism, it was one other thing. It was the Jagaban of the Nigerian political space. It's also the Jagaban of the development solution for Nigeria. Let me on this note welcome to the microphone the President, Commander-in-Chief, Federal Republic of Nigeria, Bola Ahmed Tinubu, GCFR.
Please be seated. Before I made this statement from my boss, I thank Dr. Ipaya for this wonderful comment about the president. It means he knows so much about him. Something that the late President Buhari had said about him. His exploits in Lagos, the transformation of Lagos under his watch, and he said Nigeria, that President Tinubu would replicate the Lagos example throughout the country. Your Excellencies, I stand here in representative capacity. Directed by Mr. President to represent him. He would have loved to be here himself because the health is a major plank of the agenda he has signed with the people of Nigeria. That's why when the Minister of State was speaking today, the funding for health has also gone up a very exponential way, just like funding for power and so on and so forth. And it's on vacation leave. Therefore, permit me to read his statement before you. Members of the National Assembly, my colleagues, ministers of Health and Social Welfare, Professor Nadi Pate, the Honorable Minister of Power, Chiu Adebayo, the Honorable Minister of State for Health and Social Welfare, my friend, Dr. Salako, the head of Civil Service Federation, ably represented by the Permanent Secretary. Our development partners, Permanent Secretaries, Health and Power, DG Governors Forum, Directors, Ministries of Health and Power, heads of agencies of government, states, commissioners of health and power here present, Vice Chairman of the Planning Committee, I've already mentioned him. Gentlemen of the press, invited guests, ladies and gentlemen, it is an honor and a profound responsibility to stand before you today at this National Stakeholders Dialogue on Power in the Health Sector, organized by the Federal Ministry of Health and Social Welfare in collaboration with the Federal Ministry of Power. I must first commend the cooperative spirit between the two federal ministries, testament to our administration's resolve to ensure that the MDAs no longer work in silos but as a team to ensure they deliver sustainable solutions to societal changes. This gathering represents a significant step in our collective journey to deliver a cornerstone of modern healthcare that enables the delivery of essential services, improved outcomes and efficiency and effectiveness of our healthcare system, reliable, sustainable and cost-effective access to electricity. Today we face a pressing issue that affects every Nigerian, the persistent power supply crisis in our tertiary hospitals and public institutions. Well, it's been addressed, as you heard from the Minister of Power. In surgical theaters, maternity wards, intensive care units, laboratories, and emergency rooms across the country, power outages too often compromise safety, interrupt care, and cost lives. This crisis demands our immediate attention and concerted action, and that is why we're here. These outages cannot continue, and under our administration, they should not. Lives are at stake. We must set new direction and act now. Let me therefore affirm unequivocally that my administration is fully committed to the transformation of our health sector by targeting innovative solutions and the hydra-headed challenges bedeviling the sector, including the suboptimal, erratic and often uneconomical electricity supply that drives up the cost of services, disrupts care, and compromises quality and increases patient dissatisfaction. This initiative to advance energy solutions in our hospitals is not an isolated intervention. It is an integral part of the strategic direction of the Renewed Hope agenda to address energy poverty in Nigeria by decentralizing and deploying tailor-made solutions and promoting private sector participation. Through the Energy Transition Plan and our power sector reform initiatives, we're building a robust foundation to cleaner, more resilient and more decentralized energy delivery systems across Nigeria. This has been mentioned by the Minister of Power. These efforts are deeply rooted in the principles of sustainability, innovation, and inclusivity. In alignment with our energy transition plan, we are, one, expanding off-grid solar and hybrid systems to reach critical public infrastructure. Two, incentivization of private sector participation
through favorable regulations and fiscal frameworks. 3, promotion of public-private partnerships as vehicles for sustainable energy deployment. 4, leveraging blended financing to catalyze investment from development partners, international financial institutions, and local financiers. 5, supporting the efficient management of energy resources, including improved security for energy installations, recovery of investment capital and profits, and sustainable management of waste from deployed energy systems. This national dialogue is therefore not merely a discussion forum. It is a launching pad for collaborative action, strategic alignment, and shared responsibility empowering our nation's health institutions. To our development partners, I sincerely appreciate your sustained collaboration and urge you to continue supporting innovative energy health interventions that are scalable, context-driven, and inclusive. To the private sector investors, Nigeria is open for business in health, energy, and infrastructure. We offer an enabling environment, clear frameworks for return on investment, and a government willing to partner with credible investors in renewable hybrid energy systems. The potential benefits to your business are significant. To our health institutions and facility managers, I urge you to think beyond temporary fixes. Let us design and implement efficient, maintainable, and community-owned systems. Honorable Ministers, distinguished ladies and gentlemen, this national dialogue must not be a mere talk shop. It must yield actionable outcomes, including the review and alignment of national and subnational policies on energy access in the health sector, the institutionalization of energy audits and planning within our hospital systems, mobilization of social investment, and diverse financing streams, including green bonds and concessional lending for energy supply to the health sector, and establishing result-driven monitoring and accountability framework for implementation, among others. As I conclude this address, let me congratulate the Ministers of Health and Social Welfare, Professor Muhammad Ali Patel and Dr. Adekunle Salako, Minister of Power Chief Adebayo Adelabo, development partners, and all those who work to make this dialogue a reality. The dialogue is a defining moment. Let it not be said that we gathered, spoke eloquently, and departed without resolve. Success of this initiative will not be measured by the speeches we deliver, but by the uninterrupted light in our hospitals, the hum of functional equipment, and the renewed confidence of every Nigerian who walks through the doors of a public health facility. As President of the Federal Republic of Nigeria, I fully support this initiative. It will receive the highest political backing necessary to translate ambition into execution. Together, let us energize health, empower institutions, and protect the lives of our people. Thank you, and God bless the Federal Republic of Nigeria.
Can we remain standing as the representative of His Excellency, the President of the Federal Republic of Nigeria, is taking his seat. Thank you so much. And with that presidential approval, thank you so very much. Please, let's give His Excellency another big round of applause. Thank you so much, and we can have our seats. Thank you so very much. With that presidential seal of approval, and I made some notes, that this dialogue has the highest and the most critical support that you can get in this country, a presidential backing. Please, another round of applause. That means that seal is upon every discussion here today. Whatever strategy you put forward, the president himself has said that he's going to back it as long as it's going to work, because the only way to measure success, and thank you, sir, is not just in the talk. And he said eloquent talk, and Nigerians can be quite eloquent, but in how many megawatts we are going to generate, and by extension, how many lives we are going to save because we have this dialogue. Ladies and gentlemen, we have come to the end of this very beautiful event, and we shall be concluding the way we started with the national anthem of our dear country, Nigeria. National anthem, please. Nigeria, we hail thee, our own dear native land, though shrine and town may differ, in brotherhood we stand. Nigerians old and proud to serve our sovereign motherland. Our flag shall be a symbol that truth and justice reign. In peace or battle honored, and this we count as gain. To hang on to our children a banner without stain. O God of all creation, grant this our wandering quest. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. Thank you so very much. We have come to the end. We want to take pictures. The SGF, please, if kindly